I will say something. I've been working in mental health. I think pretty soon I'm going to get my board without going to school for it. But Dr. Dalal did not agree. But let me say this. I can see where is the gap. There is a gap. Really, there is a gap how we can approach these educators that we want them to be perfect. The school is a closed box, and we are outside and they are inside. And to get inside the school is not easy. They are very busy. They are hectic work. They don't have a time to think about you or about your education or anything. Even you offer it to them, it's very hard.
I want to thank everyone on the behalf of Kids Heart Medical Center for joining us, especially since we've changed to evening time. So we really appreciate that. And we really value education at Kids Heart Medical Center. I also want to thank Dr. Haneesha for joining us. I'm a big fan of Dr. Haneesha. Of course, I'm not biased because she's another developmental and behavioral pediatrician. She's one of the respected pediatricians at Neuropedia in Dubai. Some of her interests include autism spectrum disorder and early intervention programs for developmental disorders in children. And so she's going to be talking about a very important topic. She's volunteered to do the journal club for us on professional development targeting classroom management and behavioral support skills in early childhood settings. And this is a systematic review. So if you can get started, Dr. Haneesha, we really appreciate it. Thank you so much.
Hi, good evening, everyone. Thank you so much, Dr. Dalal, for the kind introduction. Let's get started. So we will be speaking or reviewing the journal which was chosen today. I hope some of you had a chance to go through this, and for those who didn't, it's all right. Maybe we can learn more about the journal through our discussion in the next 30 minutes. This is a systematic review which we'll be talking about, and like Dr. Dalal mentioned, it's about professional development, which is targeting classroom management and behavior support skills, especially in the early childhood settings. I have no conflicts of interest, and there's been no funding for the presentation. We'll mainly be talking through over the next 30-35 minutes about the article, the journal, and the authors. We'll be talking about what exactly did the systematic review look into on a closer detail, what were the different data that was collected and analyzed, and how it is relevant to our setting. And we'll also be looking into the critical appraisal of the paper and understand how the paper was reported. To begin with, this was picked from the School Mental Health Journal. This journal carries an impact factor of 2.6 and a 5-year impact factor of 3.2. I'm sure a lot of us go through reviewing articles, but for some of them who may not be aware of what an impact factor is, just to try and understand what it means. It means, let's say we have an article published in a particular journal. What is the chances that this article is going to be referenced or cited by the other journals in the next year or two, right? So most journals have an impact factor ranging between 1 to 5, and some very good journals can have an impact factor all the way up to 30. So when we say the impact factor of the journal we picked, this is School Mental Health is 2.6. That means there's a 2.6 times chance that this article is going to be cited by other journals in literature thereafter. It's a quite recently published article. It was just 6 months ago in December 22 that this has been come up. And interestingly, we have all the 3 authors from the Florida University. And a special note to Ms. Averill. This is actually her first publication, and she is a PhD student. She's been working along with Ms. Katie and Mr. Gregory, who are the assistant professors, and they do have a lot of publications added on to their series. In today's journal that we're going to review about, I'd like to first concentrate on the topic. I know it looks a little too big and too much information, but let's just maybe pick it in pieces so that we're understanding the article a little better. Focusing on the first and most important part, which is the early childhood settings, right? And we all know that early childhood is so important. We have the last 2 to 3 decades, which has re-emphasized the whole importance of brain development in the first 5 to 6 years of life. And we do understand 90% of the brain development happens before the age of 5. So we're talking about extremely crucial years of early childhood development, where we do see across different areas of their motor skills, their language, their communication, behaviors, and socio-emotional, we see tremendous amount of skills that these children are actually developing. And what adds to this is the neuroplasticity of the brain, which is extremely high in these early childhood years, which means the environmental influences can actually impact the way the brain is wiring and the way the skills are being acquired. So the early childhood setting is such a strong base or such a strong foundation for a child, which in fact lays that path for future. And what skills are these children acquiring in these first 5 years, or where the 90% of brain development is happening, is what is widespread holistically into all areas: their motor, their speech and language, the communication and social skills, their cognitive abilities, and also the way they learn to be adaptive and various behaviors that come into it. Although we know development is not so clear-cut like it's represented in the picture, it's a lot more complex with all these interacting with each other. But fairly, these are the different domains we look at when we are assessing the development of the child, which takes place in the early years. Now, what exactly do we mean by early learning that is happening? So learning is something which is lifelong, like say now we're all learning. But when we say early learning, these are activities or certain experiences that the child has. And they're different from the learning which we're doing now, because these impact the developmental changes in the child. And this is something which specifically happens prior to their entry into elementary school, or prior to their entry into year 1, let's say, predominantly in nursery, preschool, or kindergarten, based on different parts of the world, what they're called. But predominantly, this is the early part in which learning happens. And when we say early learning, or when we say, yeah, the child is in preschool, what exactly is that the child is learning? Is it just academic readiness to go into grade 1, or is it just about intelligence and things like that? Not really. The child's actually learning well-coordinated motor skills, to communicate effectively, the behaviors, socio-emotional skills, how to regulate themselves, peer relations, and higher order thinking skills. Now, in short, we all aim for a circle of well-being. As adults now, so much goes on to mental health, where we need to be well in all aspects of our life: physically, mentally, emotionally, intellectually, spiritually, professionally, socio-emotionally. Now, this circle of well-being is what has its foundation right at the early childhood years. And the early learning is what is catering to these aspects, which I think is incredible in terms of the path it sets forward for them in the future. The next question is, okay, we've understood what they learn, but how exactly are these learning? Children have this inherent ability or potential to learn a skill, and we as caregivers, teachers, and various professionals have to provide them with the right opportunity and the right foundation for building the skills. And when we say right opportunity, we mean a safe, enriched, stimulating environment, which also gives them a good start and a good socio-emotional attachment to begin with. And we know when early years, this opportunity or foundation is either happening at home, where most of the time there's a caregiver, a nanny, a parent, or other family member who's there, or it's also happening alongside in an early educational center or a preschool or a nursery that is taking place. So if we look at the pattern, this age group of 2 to 5 or 3 to 5 is what is called the early childhood educational years, where they are learning all these skills. They are learning, playing, and growing together. And the person who takes care of them in the school setting is none other than an early childhood educator. Maybe I'll just call them preschool teachers for the ease of our discussion through the talk. And they play this role of providing them the opportunity and foundations we were talking about, laying that groundwork for them subsequently, right? So what exactly do they do? So it's going to be a lot of fun. These childhood educators are going to deal with a whole lot of toddlers, 2 to 5 year olds, who are going to be a lot of enjoyment and liveliness and so full of energy to be around. So what exactly is their role when we say a preschool teacher? They're giving them these learning experiences. They're responding to and comforting children because they're still socio-emotionally quite in the stage of maturation. They're taking care of their health and hygiene because they still need to be watched over and they're not completely independent. They take care of planning their curriculum on the kind of learning opportunities and activities to provide. They also do have a lot of administrative tasks and also need to communicate with the caregivers. And I'd like to highlight one other very important roles that they play is communicating with the healthcare professionals as well, especially when we have children with developmental concerns or behavioral concerns. A lot of time, it is these early childhood educators who are able to pick up because they spend a significant amount of time with the children. So they're able to pick those children whose development may be delayed or deviated and are able to alert the parent or alert the healthcare professional that there's something that needs to be looked into. And that's a huge responsibility that they take forth in the overall childhood education that's happening. All in all, I think they're looking into these various areas of learning for a child and preparing them, which is incredible because they also have a lot of challenges to overcome, right? So this is a wonderful book, which you can see on the right, is Early Childhood Education Hard to Teach. From a teacher's perspective, they did bring about some of the challenges that they have. Yes, it may look wonderful with a lot of toddlers around, but what's the challenge? Like I said, the varied developmental needs, right? So this is not a group of children, let's say in year 10 or grade 5, who are just all ready and set, waiting for the teacher to teach so that they can imbibe knowledge. These are fairly maturing or developing children who have a lot of developmental needs to whom they cater to. So that's quite challenging for them. They're still in a very formative years of social, emotional, and behavioral regulation, and their communication is still developing, where we call the terrible twos and so on. So there's a lot of behavioral challenges that are going on for them to be able to handle. To add to this, most studies do bring forth across the globe that the overall workforce is less well paid, and there's a huge stress on the challenge that they have in terms of their work. And also, I think it's quite underrated because their years of formal education are a lot lesser than what we see for higher education teachers, where in fact, I think they need to have these opportunities. There are fewer opportunities for these early childhood educators to upskill themselves, to learn, let's say, how to manage the classroom, how to behaviorally support these children, compared to those higher elementary grade teachers. So I think the author has taken this as the relevance of the study. So the idea of me to bring forward this introduction is for us to understand why was this topic chosen, or why did the author really feel the need to interview something like this, is where they have seen the opportunities that they have is a lot lesser, and there's so much of a need for them to upskill themselves because they are technically handling the most crucial years of a child's entire period, the early developmental years. So they need to be really well equipped before they are able to do this job with less challenges, right? And what is that they need to be trained in? This is a teaching pyramid, which is quite much standard followed across the globe, which is a model on this professional skill development that happens to these preschool teachers, where if you see at the base of the model is effective workforce. And I think this translates to workforce across different professions as well, that it's important to have a good effective workforce to get on top of the pyramid. And most of these teachers have to be trained with the basic nurture and responsive relationship, where they know how to build that rapport with the child and providing high quality supportive environments, which is again learning how to have a well equipped and well developed classroom environment, because this targets at building the socio-emotional competence of the child. The upper parts of the pyramid, I would say, is for a lesser targeted population where they have behavioral challenges or maybe other developmental needs, which lead to more intense interventions. But this primary thing is what every child needs. And this is what every early childhood educator should be equipped enough to handle. So I think they're just superheroes if they're early childhood educators whom you all know of. I think it's very important to maybe, just to give them a kind note of appreciation after the talk. And for all of them who are already in the talk, I think it's wonderful of the incredible work you all do managing the entire hustle and taking such a huge responsibility of catering to the early childhood years, right? So the paper today is more about this. To break it down in this early childhood settings, which means these preschool years, we're talking about what is the availability of their skill training. What are they training themselves into managing classrooms or helping them understand what are the behavioral strategies we use for handling the behaviors in the classroom. So the author has had a very systematic review, pulling in the entire data available up till 2022 on professional skill development for these preschool teachers in these areas. And they've reviewed and brought about different aspects of results, which we will be talking about subsequently. A quick note on what a systematic review is. Now, we all know there's a hierarchy of scientific evidence where systematic review is one among the top. So basically, let's say we have a review in question, or we want to know about something. We usually go and, let's say, put it on Google or put it on PubMed, and we try to understand what information is available, right? Now, when the same information, we may get like hundreds of thousands of articles about a particular data we're looking at. Now, when all this data is compiled in a very systematic manner, analyzed, and the results are presented in a very detailed way, is a simplified way of saying systematic review. So it is a very systematic way of approaching to a particular information and analyzing them and presenting the information. That's what the author has done. So they've looked into a lot of things to understand about professional development, where they find where is the area of need. So this author has found professional skill development in these preschool teachers as an area of need. They have designed a beautiful review protocol and which kind of articles do I want to review, what are my methodologies, and finally presented to us or disseminated their data in a very structured manner. Now, where has the author collected this data from? So he wanted to know what is the professional skill development available across the globe. So they have used two important databases, which I've mentioned here, the ERIC and the APA, and they've used the basic keywords, which are a part of the topic. And they had an inclusion criteria set as to which articles among these will be screened and included in our systematic review. And the inclusion criteria included the method which was used to train them. At least one staff member should have been trained, the study design, it should have been in English, and it should have been a published paper. So when it met these inclusion criteria, those articles were included in the study and further analyzed. So when we look at the methodology, when the author used these keywords and put into the database, they had 3,108 articles which are available on professional skill development in early childhood settings. And they went through their inclusion criteria and screenings independently among the three authors. And finally, 42 articles were relevant to what they wanted to study about. And these were included in the study, and the data was systematically analyzed. What did they study from these 42 articles or which were presented? They studied the different kind of approaches of the skill training, the professional development training. They looked into the various characteristics of the training and the people and the children who were involved. And they also looked at what kind of studies were these 42 articles, or what kind of programs were designed across in these, and they reported the outcome among all of them. To quickly understand, what do I mean by skill program approaches? Now, I know this slide is a little busy, but I just want you to get your attention onto the boxed area. These are the strategies which were used in the 42 different articles that they studied, which were taught to the preschool teachers, right? And I'd like to mention a few of these because this is of extreme relevance, I think, in our day-to-day life for most of the professionals who would be attending or being a part of this talk. One of the important things is antecedent control, where in simple words, you're trying to prevent the trigger, which is the cause of a challenging behavior in a child. Positive reinforcement strategies, where you're positively reinforcing a particular behavior through a well-known positive consequence so that the chance of this appropriate behavior continues, right? Or you respond to a challenging behavior. So that's a tantrum, there's a problem behavior. How do I respond to this child? So the teachers were taught maybe how to give them a timeout, how to distract them, or what do you do in such a scenario? They were also trained on techniques for teaching expected behaviors. Now, the first three is when a behavior occurs, but what about in the general well-being time? You also focus on improving their overall socio-emotional and behavioral competence. So the last three skills are trying to build this positive relationship, which was again the base of our pyramid, and building in skills so that the very behavior itself can be more appropriate and not challenging for them. What else did they look into in these 42 articles? They looked into the different kind of centers. Were these early childhood centers inclusive for children with determination or not? What kind of training was given to these professionals? Was it one-on-one? Was it online? Was it in person? Was it group? Was it through conferences? How did it happen? who was the training? Who gave these early childhood educators this training, right? They looked into when was it given, for how long was it given, was it a structured program, what were the components of it, how did they measure if this training was effective or not, and the study design of this. So this was the information that they collected from these 42 articles. And what was the results of the systematic review that they have done? Now they found out that if you look here, about 50% of these articles, which means roughly 20 of the 42 articles, were a randomized controlled study on the professional skill development which happened, which is fairly good because we know it is a fairly good upper hierarchy in the reviews. What else did they look into? They looked into the center type, right? So among these studies that they were done, or the articles they looked up, majority were public sectors, which reinforces possibly that there should be more opportunity for upskilling in private sectors, or maybe more reporting of such training programs so that we get a lot more data on how effective it is. They also looked into the format of administration. And if you look here, a good number of administration was group instructions and individual coaching or in-person coaching. But a very small amount was peer coaching and an interactive case study. I think these two are quite underrated because we do see peer coaching is so important, right? Let's say even at a medical professional level, a doctor to nurse and a nurse to nurse, we always know a nurse to nurse teaching is going to be a lot more. So it's always a peer coaching, which seems to be a lot more effective. So this study also tells us possibly a peer coaching is something which we can work on, because it seems to be a gap of area, or very small proportion of them are actually looking into or doing this. The next interesting thing they looked into is who trained these preschool teachers, right? Now, if you look here, 70% of the training was by research staff. What do we mean? Let's say I'm conducting a study on professional skill development and I'm a part of the research. I am training the preschool teachers as case control groups, and I'm doing it. But if you, barring this, if you see, there's barely 20 to 30% of them who were trained otherwise outside research, which again reinforces the need of healthcare professionals, therapists, pediatricians, and other administrators who are involved, who can put into helping upskilling these early childhood educators in their skills. Most of the training was conducted during the school days, which is again fairly okay. And like we said, most of the training looked into either preventing the behavior by preventing trigger or managing a good behavior. But only half of them really looked into the pyramid skills, which we were talking about, which is again a scope for us to intervene and look further into. Another interesting thing is whenever we have a training, let's say we've trained the teacher to upskill themselves, it has to reflect into a better classroom environment, a better child outcome. And unfortunately, nearly 50% of these studies did not report any child outcome, which again gives us a bias that how effective is the training, or how was the training outcome even measured, because that kind of again underrates the importance of educating them and upskilling their abilities. And last but not the least is additional component intervention, which means apart from educating the teacher, was there anybody else who was upskilled and educated about? And if you see, not too many, right? Which again is a scope for us, because when we're looking at a child, we're not looking just at the teacher. It's a holistic approach, right? So let it be the caregiver, the nanny, the parent, the other therapists if they are involved. Everybody needs to be on the same page, which means it gives us an opportunity to upskill not just the teacher's ability to handle the behavior of a child, but the entire environment or the microsystem around the child should be well equipped and trained on how do I exactly help this child improve in their various skills, right? So that's the entire information that they have reviewed and kind of presented it to us so wonderfully from the 42 articles that were there. Now, to think of what really is the implication of this journal, or why did the author do this, or what are the future directions that we have? Like I mentioned, private preschool settings have a lot of opportunity for upskilling. Research staff was mainly the one, so maybe it's our responsibility as well to start educating them and helping them in their professional development. And of course, it's always important to tailor this because it's not like a universal blanket rule for all of them, based on the kind of centers available, based on the kind of schools, based on the uniqueness of the school climate. I think we need to kind of tailor these early childhood educators on what kind of professional skill development happens, and most importantly, cater to the diverse population. So I think that's something as well which we can add on or learn from the study. We do know the neurodivergent population is going up to maybe about 25 to 30% already, which means we're seeing 1 in 3 or 1 in 4 children who are neurodiverse, right? Which means the early childhood educator is not just upskilled on how to handle a neurotypical child in that age, but also a neurodiverse child, and also recognize and support them adequately. So that's another area of future direction for us in terms of how we can help. So what is that was already known before this journal came out, let's say 6 months ago? We already knew early childhood educators are extremely stressed because their jobs are so challenging. We knew that there was an immense need for upskilling themselves and learning a lot of professional skills about classroom environment management. And we know that these upskilling help them be stress-free and manage children better, right? So we already had this information. What is that this study has actually added on by reviewing systematically this is it has taught us about the various kind of approaches we can use in professional skill development, the different strategies we spoke about. It helped us understand the characteristics of how this professional skill development takes place for these teachers. It helped us understand the kind of research designs and protocols that were used and the kind of outcomes that was measured. And it also highlighted to us the areas where there is a scope to improve, or I would say the missing gaps in the puzzle, right? Which again is something I feel we should be taking home from the journal. And one other thing which we often do when we're reading a journal or doing a journal club is what we call critically appraisal. What is critical appraisal? Now we are talking about one, how relevant is this journal or systematic review that has come up? Is it well done or not a really well done study? Is it well reported or not, right? So we often have checklists, which are standardized tools, which help us understand or answer these questions of relevance, well done, and well reported or not. Now, for the systematic review, which we've done here, we've used the PRISMA checklist, which checks every aspect of an article, right? Like the title, the abstract, the methodologies, the conclusions, the limitations. So there are a lot of things that go into writing an article. And the checklist helps us understand if these basic needs of a well-reported paper have been met, right? So like you can see, I've just put down a quick checklist, and all the green boxes means the author has actually checked all these boxes. They have included as per the requirement, and the red boxes means they have not been able to meet those areas. But like you can see, majority of their checklists are green, and there were very few areas where the author had not mentioned. But I think fairly, it was a really well done, well reported, and well reviewed paper, giving us a lot of information about existing data. To highlight the relevance of study is, why was this relevant is because there is very limited information. Like I also tried to look into see what information do we have for our region in the UAE, what is the professional skill development in early childhood settings, and I could barely find any papers, right? Which means there's so limited information about upskilling them and upskilling these teachers who are really, really needed to be upskilled. It also highlights that there are some missing areas which we spoke about regarding the study characteristics, the way we can design it, the areas which can be met. So I think that gives us a lot more highlight or focus into the areas which we can capture too, and insight, and kind of use it in our settings to help understand which are the areas of need and intervention. And it helps us to, again, refocus, rethink, and prioritize to upskill professional skill development in these early childhood educators. And I think our role becomes very tremendous here, because we should not wait for somebody who's conducting a research to go teach them and then do the case controlling and it's done. I think it should become a lot more, we should give a lot more opportunities to early childhood educators and preschool teachers to help, because they're all willing to learn. And I'm sure Dr. Dalal would agree with me that, when we visit schools, when we talk to them, they're so eager. They want to know. They're like, how do I handle this? What do I do? How can we help? What is that we need to know? So they all really want to upskill themselves and learn better on how they can cater to such a challenging population. And it becomes our responsibility, as well as healthcare professionals and therapists and everybody involved in early child care, to help upskill them and teach these, because they are so important, dealing with the most crucial golden years of the brain, and the responsibility we're giving on them is huge. So I think we should also give them the same huge opportunity to help them be well equipped with all these skills to cater to such a population which is taking place. And of course, I think, like I mentioned, it becomes an area of need, because I think it would be wonderful. I think Dr. Sulaiman would also be able to add on if we should conduct maybe a similar, this gives us into, should we kind of prospectively look around as to what's happening? Are we able to provide these professional skill development to early childhood educators in our region? And what is the data that we have? Maybe just look into it to understand where is the missing gaps happening with us, and how much can we pitch in to help them upskill, and how much can we cater to affecting the population which is in need. All right. So that's about what it is. Thank you so much. And like I said, let's together make a difference when it matters. If anybody is interested to know more details about the article, any of the data that I have gone through, I've just left in my email ID, and I'd be really happy to discuss more about it. Thank you.